Okay, so today is Wednesday, October 15th, 2014. Uh, Things are still unraveling here as time goes on, but this morning there was breaking news that a second nurse had become infected with Ebola. Uh, this nurse and the other infected nurse were both uh, both treated the uh, the gentleman that was in the hospital admitted with Ebola the other day. His name is Thomas Eric Duncan. Um, he has since passed away, uh, and this is going to get out of control. This is just the beginning. Um, in this situation, there's things coming out now that you know the medical employees weren't really trained, and you can't really blame the health workers. Uh, I put the blame on the the CDC, on the government. The higher ups. They should all be training. There should have been training for this. They know there's a major Ebola outbreak. Uh, in other areas, it spread. Um, they should have had training and had the right equipment to handle this kind of thing. And I feel that they should have closed the borders, banned all flights from any areas where there was any current Ebola infections. But they have yet to do that. Then, according to the CDC, they will not do that because apparently they feel that that won't work or whatever. That would have a bad effect, which makes zero sense. But some things here I've been looking at, and Ebola. A lot of people keep telling me, oh, it can't be transmitted through the air. It can't be It's not airborne. It's not airborne. Okay. Well, it's been known for at least 2 years that they're that it could be transmitted through the air. I mean, it can be transmitted from animal to animal. It can be transmitted from animal to human. So this is a study here done by the Center. No, that's the Center for Infectious Disease Research and Policy, CIDRAP, at the University of Minnesota. Okay, they have advised the CDC and the World Health Organization that it has the potential to be transmitted basically through the air. Okay. Now, my theory, okay, is you have somebody with Ebola, okay, that's something that's that deadly. I mean, we're talking a death rate of upwards of 90%. Some areas, some instances, it's been less. But things that I saw were, bare minimum, in some places it's like 50%. Supposedly right now it's about 70. My opinion, you got somebody with Ebola, all bets are off. I don't care. Stay the hell as far away as you can. That's just crazy. Why even be remotely close to a situation like that? Okay, so I'm not really gonna go into this. I'll post a link. I'll post the links here that I'm using in the description, but I'm not gonna really hit on this. But I mean, there's this here. There's a study done a few years ago that it can be transmitted, through the air. So I mean, it can happen. It's not just by contact or through bodily fluids or whatever. One thing I want to point out too is very important. There's a discussion about the masks. I know the N95 masks are very good. I'll bring that up again in a few minutes. I'll look them up. The were supposed to be a really good match. But this here, the CIDRAP, okay, right here you can see it's a warning that surgical face masks do not prevent transmission of Ebola. Healthcare professionals must immediately be outfitted with full hooded protective gear and powered air purifying respirators. Now, if they've been wearing respirators for a while, okay, so that's an indication right there that they've probably known that, or at least suspected that it could be transmitted through the air. Okay, but now, I mean, this is blatant right here that they know that it can be transmitted through the air, and if they're taking those precautions, then everybody should be taking those precautions. Okay, so let me close that out. Okay, now I have yet to find anything on. I tried looking up an Ebola quarantine procedure that, there's an outline of exactly how a quarantine, or how a quarantine was handled, or if someone had, you had to isolate somebody, how it would, you would do that. But of course, I couldn't find anything. Somebody knows of it or finds it or whatever. Maybe you can send me some kind of message or something, and we can link to it. But I did find this: controlling infection in healthcare settings. Healthcare workers should always take standard precautions when caring for patients, regardless of their presumed diagnosis. Okay, these include basic hand hygiene, respiratory hygiene, use of personal protective equipment to block splashes or other contact with infected materials, safe injection practices, and safe burial practices. Okay. One of the articles, and I'll show you in a minute, that I came across was that when this guy, Thomas Duncan, was being treated in the emergency room at this hospital, he was out in an open area of the ER, and he was just exposed to everything, and they didn't really have the proper equipment, and hazardous waste was, the medical waste was piled to the ceiling and stuff like that. That's not, it's not how things should be. It's not how, it's not the kind of thing you want to be doing if you want to protect yourself from getting it. Okay, goes on to say healthcare workers caring for patients with suspected or confirmed Ebola virus should apply extra infection control measures to prevent contact with the patient's blood and bodily fluids and contaminated surfaces or materials, such as clothing and bedding. When in close contact within 1 meter of patients with EBV, healthcare workers should wear face protection, a face shield or medical mask and goggles, a clean, non-sterile long-sleeve gown, and gloves. Again, other articles said that probably won't work. Probably not enough. I would, you see these guys, they're in the spacesuits, the full-on hood spacesuits, like the guys in E.T. That's what I want. I wouldn't, I wouldn't feel safe being anywhere around it, but I would at least, I would at least want that. I don't think you could, in a situation like this, you could have too much protection. So some other things here. Ebola virus disease, or EVD, formerly known as Ebola, hemorrhagic fever, severe, often fatal illness. Let's see, virus is transmitted to people from wild animals and spreads in the human population through human-to-human transmission. Average EVD case fatality rate is around 50%. Case fatality rates have varied from 25 to 90% past outbreaks. I saw a chart that didn't show anything less than 50%. So I don't know. It's just lower to 25. I don't know about. First EVD outbreaks occurred in remote villages in Central Africa and in tropical rainforests. Most recent outbreak in West Africa has involved major urban as well as rural areas. Let's see. Community engagement is key to successfully controlling outbreaks. Good outbreak control relies on applying a package of interventions, namely case management, surveillance, and contact tracing, good laboratory service, safe burials, and social mobilization. See, the problem there is, um, outbreak control doesn't rely on package of interventions. Well, see, that's not really happening in this case. You know, they're not. They could close the borders and stop flights, from these areas where there is Ebola, but they're not doing that. So, early supportive care with rehydration, symptomatic treatment improves survival. There is as yet no licensed treatment proven to neutralize the virus, but a range of blood, immunological, and drug therapies are under development. Currently, no licensed Ebola vaccines, but 2 potential candidates are undergoing evaluation. Well, that's at least good. So, let's go over with. Actually, I go over a bunch of this, and like I said, I will post this link. But I just want to go over this because not a lot of people know this. Even I didn't until I read it. That talks about transmission. Let's see the incubation period. From the interval from infection to when symptoms will show up is 2 to 21 days. It's not infectious until symptoms develop. First symptoms are sudden onset of fever, fatigue, muscle pain, headache, and sore throat, followed by vomiting, diarrhea, rash, symptoms of impaired kidney and liver function, and in some cases both internal and external bleeding. Laboratory findings include low white blood cell platelet counts and elevated liver enzymes. Diagnosis. Let's see, it can be difficult to distinguish EBD from other infectious diseases such as malaria, typhoid fever, meningitis. Confirmation that symptoms are caused by Ebola virus infection are made using the following investigations: antibody capture enzyme, link, immunosorbent assay, antigen capture detection test, serum neutralization. I'm not going to go through all that. Prevention and control. This is, I read that earlier. Good outbreak control, package of interventions. And they're not really doing that. Now, like some of this, just raising awareness. They're doing reducing the risk of wildlife to human transmission, reducing the risk of human to human transmission, and outbreak containment measures. Okay, so let's go on here. Quarantine procedures. This is some survival thing that I was looking at. One thing that this is what I wanted here. Antiviral biomask. But I don't know. Of course, there's not really a good picture here, but these are the N95 respirators here. But I don't. According to what that says, I don't think that would be good enough. Like it says reduces risk of fluid strike through, protects against micron-sized particle, features a large breathing chamber with advanced filtration. Even still, I don't think that would be enough. I really don't. You could go through here. Right now, you know, this kind of thing is is a hot item. There's a lot of this going on. A lot of people, I've heard the sales of this stuff is going out of control because a lot of people, they're buying this stuff because they want to, protect themselves and stuff like that. But if you could come take a look at this stuff. So I was reading through the news this morning. So here's an article. Here's a list of conditions they said they faced while treating the first Ebola patient. Okay, which is the guy from Liberia, that Thomas Eric Duncan. Okay, and here's where it says, right here, this is from the Associated Press, that he was left in an open area, Dallas emergency room, for hours. Nurses treating him worked for days without proper protective gear and faced constantly changing protocols. Okay, now that's absolutely nuts. That they didn't know. They knew they had to have known that he had Ebola. Why would they do that? Why would they be forced to do that? I mean, yeah, I could say it's their fault because they didn't say, hey, wait a minute. Like, if that were me, I would say, hey, wait a minute, I'm not doing this. We have to be protected. And the hospital isn't doing that. They can't handle this Ebola, and they can't keep their employees protected. Okay, honestly, if it's confirmed that someone has Ebola, okay, what they should be doing is they go into quarantine and they go right to the CDC. Okay, they go to the CDC and that's where they get treated. There's a complete, quarantine area that's completely locked down. No ifs, ands, or buts. This is, a life and death situation. It's going to get out of control. Like I said, this is only the beginning. The first guy, this Thomas Duncan, who's now passed away, 70 healthcare workers came into contact with him. So now they're monitoring those 70 healthcare workers. All right, they've since been monitoring like another 50 people. I guess that had contact with him before he went to the hospital. Okay, so goes on to say nurses were forced to use medical tape to secure openings in their flimsy garments, worried that their necks and heads were exposed as they cared for a patient with explosive diarrhea and projectile vomiting. Isn't that wonderful? Conference call. Several and a few nurses refused to repeat. I'm not going to go through this whole thing. Like I said, I will post an article here. This link, you guys can come read this. And I think this is totally bogus. Here it says, this is a statement from the hospital. Patient and employee safety is our greatest priority, and we take compliance very seriously. We have numerous measures in place to provide a safe working environment, including mandatory annual training and a 24/7 hotline and other mechanisms that allow for anonymous reporting. That is the biggest crock of bullshit I think I've ever heard. This dude, his name is Wendell Watson, okay, spokesman for the hospital. He just wants to cover his ass. All right, if they had numerous measures in place, okay, and annual training, then these healthcare workers, these nurses, would know what the hell they were supposed to do. Okay, there wouldn't be breaches in protocol and all this other bullshit going on. Of he's in this open area in the ER. It's a total crock of crap. Okay, nurses allege that Duncan was kept in a non-isolated area of the emergency department for several hours, potentially exposing up to 7 other patients to Ebola. Patients who may have been exposed to Duncan were kept in isolation only for a day before being moved to areas where there were other patients. So that's wonderful. Let's help in spreading the Ebola around. Okay. Nurses treating Duncan were also caring for other patients in the hospital. There you go. Now you got more. See how it spreads? It's going to spread out. Preparation for Ebola at the hospital amounted to little more than an optional seminar for staff. Yup, there's your training. Okay, an optional seminar. In the face of constantly shifting guidelines, nurses were allowed to follow whichever ones they chose. Yep, there's your training, Wendell. Okay, you just kind of figure it out on the fly. Yep, here's the union right here. Breach of protocol. There is no protocol. Exactly. Stupid. Absolutely stupid. This Wendell Watson guy ought to be fired immediately. Absolutely ridiculous. Oh yeah, we got training. Yeah, your training is an optional. It's an optional fucking seminar. Optional. What kind of bullshit is that? Stupid. So then since this morning, this came out that the second nurse has been infected. Okay, which now they have to go. They have to track down anybody that she has come in contact with, and monitor those people. Okay, now this has come out. Okay, second Dallas Ebola patient flew the night before testing positive. All right, so now she flew from Cleveland, Ohio, to Dallas. Okay. Let's see. Flew on a plane. Okay. So apparently Tuesday, yesterday, she had a fever. She notified people, and then she went and they put her in isolation, tested her. The initial test, she tested positive. I guess they had to send the test to the CDC for confirmation. So this is probably Monday. Well, this article says last week. Oh no, that's the other article. Oh, okay. October 13th. Yeah, so Monday. Let's say Monday. All right. She gets on a plane. She flies from Cleveland to Dallas Fort Worth International. All right. So now they got to track down everybody that's on the plane. All right, right here, 132 people. So, yep, CDC's asking anyone flew on the plane, make contact because of the timing of the flight. Yep, so now they have to, virus is spread through direct contact. Da 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 da. Flight landed at Dallas Fort Worth, 8:16 p.m. local time. Remained overnight at the airport. He was flying for the day. Aircraft proceeded through cleaning per normal procedures. It's also cleaned again in Cleveland last night. Previous customer traveled from Dallas Fort Worth to Cleveland at 11:42 on October 10th. Oh man. So they've at least removed that plane from service. Okay, and they're working with the CDC. But now they're going to have to, these 132 people. Okay, I'd bet it's safe to say they're going to have to track down this 132 people. All right, that she flew with on the plane. All right, and then they should probably monitor people that those people have had in contact, and see how this continuously spreads and spreads and spreads. And now what about whoever she was with in Cleveland? Okay, she was in Cleveland for 3 days. I mean, is there a chance she could be, she could have been infectious at that point? So whoever she was with in Ohio, do they have to monitor those people? Is it going to be spread now to Ohio? Who the hell knows? This is just madness. Absolute madness. In the meantime, the World Health Organization says that new Ebola cases may soon reach 10,000 a week. They've said that you got about 60 days to beat this thing before it gets out of before um, basically you're dead. um, I don't know. This is crazy, and of course the government isn't. They have the ability to close the borders, to ban incoming flights, uh, from areas where this was, you know, and they have not done that. Why? I don't know. It's crazy. So here we go. Let's see what's going on here on the drugs. Okay. CDC says the missed opportunities to contain. Nurses outraged. There was no protocol. There was no system. I agree with that. There was no system. Like Wendell says, oh yeah, we had a system, we had protocol, we had training, blah 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 blah. Yeah, bullshit. Obama cancels fundraising trip. Wow, there's a shock. Let's see. Hospitals workers learn how to control Ebola as they went along. Yep, that's totally agreeable. I agree with that. Um, it's just everything else, just added up, blood, vomit, diarrhea, soaked materials piled to the ceiling. Dallas mayor make it worse. Fatal spray paint quarantine zone on entrance to gated community. Lab developing device to identify virus in 10 minutes. Liberian Health Ministry requests 79,940 body bags. UN warns 60 days to beat. Paper bullet elections October surprise. Unbelievable. Absolutely unbelievable. This is kind of scary too. If Liberia, they're requesting almost 80,000 body bags. That's a little scary. Who knows? Who knows what'll happen? It could come here. I've heard, airports, they're I guess they're checking temperatures and stuff like that, but it's who knows if that's going to do anything, if that will be effective. Are they going to be able to? Are they going to be able to catch it? Who knows? But I guarantee it's going to get worse. They have to. If they're going to leave the borders open and all these flights keep coming in, it's going to get worse. It's definitely going to get worse. So this is it for now. I'm going to end things here and go on to something else. I will keep an eye on this and see how out of control it gets. I suggest everybody else do the same. Because it's gonna change. I guarantee you. Right now it's 12:46 p.m. Eastern. I guarantee you by tonight, the end of the day, it'll get worse. You'll be hearing more things, and God only knows. I just hope and pray that it doesn't get worse, but I have a feeling it's going to. Okay, that's it for now. Thanks for watching.